you very much, John, to invite me to talk about my research and share it with the HumaniSE group. So, as John has said, my research is working with disadvantaged communities in Bangladesh, and is investigating the ways people access, share, and preserve information. And I was very lucky to get DECRA funding for to fund my research for the next 3 years. And you can see from that slide that my career path is quite unusual for an early career researcher. I got my PhD actually 20 years ago, and in the arts faculty. Then I had a long career interruption when my children were little, came back to do a graduate diploma, and then stayed on as a research assistant and as a tutor, sessional lecturer, then getting a contract position, including a position as a research fellow on the PROTIC-1 project. So I'm going to start with PROTIC-1 that provide the context to my DECRA project. PROTIC-1 was a community informatics project funded by a philanthropic donor, and it was a collaboration between Oxfam in Bangladesh and a researcher from Monash University led by Larry Stillman, and we had 5 PhD students on the project. The aim was to empower women working in agriculture in remote village of Bangladesh through the use of ICT. Bangladesh is a country with a fragile ecosystem affected by climate change and frequent natural disasters, flooding, cyclones. In that context, it's difficult for people from remote villages to have to travel to town, for example, to visit a vet when their animals have a problem, or when they have to get help with some problems that they have. It takes time, money, and sometimes it's even actually impossible to reach the nearby town when the rivers have flooded on the way. But it is a country that has a good mobile phone network. More and more people are having a mobile phone, or not often smartphone, just a simple button phone, but phones are common. So there is a good coverage. So using mobile phone to access information it's a good option. So the project worked in 3 villages, mostly in 2. The third one was added later on. And in each village provide 100 women with a smartphone as well as free internet package, so that they could access information that would help them to improve their agricultural practices and start new practices. A dedicated call center staffed by agronomists was put in place that women could call to get information and ask questions. The project started with the call center because of the low level of literacy, that the women who were barely literate could just talk to someone without having to use information in writing, although they had a smartphone that had other options. Then SMS were developed again by the agronomist, targeted for the condition of each village, and sent to the women every week. And it was understood that if the women had problem reading the SMS, they could find someone to help them read them. Then apps were also developed for the project. It was aimed to be a participatory action research project involving the women through the course of the development of the project. There was some noticeable impact, improvement in the women's life through the information they were able to access through the call center, and they got through the SMS sent to them. They started growing new crops that they could sell to the market, growing vegetables in previously barren land, or even in some little baskets and pots in their garden. Starting other ventures, poultry farms, aquaculture, or craft businesses using the phone to take orders and then sell on the market. Or one of them used a phone to take ID photos that she was selling for a small fee. So lots of new economic ventures that helped them to increase their income, not just of the 100 women in the village, but their families, their whole community, because they shared the information that they received. They definitely increased their digital literacy skills, and they become a sort of information hubs. People were coming to them to get information because they knew they had access to information that they had received through the SMS, and they could share with them, or they could call the call center for themselves, but also to ask questions that their neighbors come and ask them. And they were attending a project meeting with local officials. So that greatly improved their status in their family and in their community. One of the most interesting findings of the Protic One research from my point of view, and that influenced the research I'm doing now, is that we saw that women started writing down in notebooks the information they were receiving from the call center, so that the name of a medicine to buy to remedy a particular disease, for example, so that they wouldn't have to call the call center again later if they had the same question. And then, moreover, they started writing down the text of the SMS as well, because there had been cases of phone getting damaged, and when they were repaired, some of the data could not be recovered. So they started realizing that the digital information, those provided with those SMS in that format, wouldn't last forever, and that it may last longer if they were writing it in their notebook. And they were also writing the text from the SMS on those big sheets of brown paper that they were hanging in their meeting hall, so that they could look at them when they had meetings and they were going to the meeting hall for other reasons. So this was totally unexpected because of the relatively low level of literacy of those communities, and it's not a traditional practice of writing information in notebook and keeping information in that way in those communities. So, so it was definitely a grassroots initiative. It wasn't encouraged by the project staff. It's something the women started doing themselves. The sustainability of the project is something that hadn't been really considered from the beginning of the project. The focus was on developing digital skills. So getting the women to use the phone, to learn to use the phone, to learn to use, to access information through the phone. And the understanding was that when they learn to use the phone, they and access information, and that information helped them to increase their income, they will understand what the phone can do for them. And after the end of the project, they may go and buy their own phone. And the first time I went to visit one of those villages in 2018, that's what the women were telling me, that now that we understand what a smartphone can do for us, if the phone breaks, we'll go and buy a new one. In looking at the sustainability of the project, there's two aspects: the sustainability of the technology itself, how long will the phone last, and the sustainability of the information that the phone enable people to access. And neither of them had been really considered until the last year of the project, when there was a plan to develop an app that would include all the SMS and that would be updated. Because by then there was no project funding anymore, and the organization that was developing those SMS and looking after the call center was a for-profit organization. So they had the plan of developing the app and selling it for a fee, so that with a subscription fee, so that they could keep updating the information. And they expected that the women would be willing to pay for that fee, which I was never really convinced that would happen, because even if one or two women in the village were willing to pay the fee and then share it with others in the village, I never felt that there would be enough subscribers for the project to be financially viable. But this app was actually never developed. So what after Protic? And in the past 2 months, I had the opportunity with a research assistant to do interviews for my DECRA research that I'm going to talk about later, over the phone with some of the Protic women from one of the community, the community where we did that research about the notebook, and asking them how they are doing now after Protic, now that they don't have that support anymore. And the picture is quite bleak. Not surprisingly, most of the phone no longer work. Not really surprising after 5 or 6 years, phone being heavily used by the whole family in very harsh conditions. But most of the women haven't been able to buy another smartphone. They have only a button phone, or no phone at all, so they can no longer access the internet. Those who still have a smartphone that's still working, whether it's the original phone or a new smartphone, have problem to afford the cost of internet package, so they cannot have internet access all the time. And then there's still the question, even if they have internet access, there is not a source of information, as the information that was provided by Protic, that they can trust. They have to make their own judgment on what is reliable information and what is not. And if they Google about the solution for a disease that their goat may have, they may find 10 different suggestions, and which one is the most reliable one. There's a big step between being able to access information and being able to make a decision of what is a reliable source of information and what is not. So we are basically back to the situation we were before Protic, with people having to travel long distance to go to the town and visit the vet, or to go and get suggestions for their problems from the agricultural officer in the district level. And this can be a huge waste of time and money. Sometimes the solution comes too late, the animals may die, the plants may die, and the yields have decreased as a consequence. And there's a big problem with new diseases can no longer be cured with the medicine that had been suggested by Protic, because the pests have become resistant to the pesticides, and the disease So the dose needs to be increased, or new pesticides needs to be used. So this is based so far on 6 in-depth interviews. We haven't interviewed all the project women. It's too early to really generalize, but the picture that we are getting is mostly negative, at least on the economic side. On the more positive side, there's some suggestions, some information provided that is still useful. The practices that they developed during project are still useful. The women are still using the information. They are still writing in notebooks, and they have learned to some extent into where they can find information and more reliable information. And there is a comment in here from one of our interviewees saying that she feels she has become so self-sufficient through the project. And that is something that is a lot more difficult to evaluate, but that is remaining even after the project. And that interviewing PS2, she made that comment in relation to going to the district town for a job interview and going there by herself to a place she didn't know, but using the maps app on her phone to find the way. And she found that, oh, now that she can use her phone to go places by herself, she has become so independent, so self-sufficient. So my project is working with the Project 1 community. So that's why I spoke more about Project 1. Project 2 has moved on to work with different communities, a broader group of people. So 2 target group being the domestic workers, mostly women in Dhaka, and fishing communities. So both engaging with men and women. And the intention of Project 2 is to develop systems that will be scalable and can be used for those whole communities. It is also a broader multidisciplinary team. So we have now people from the HumaniSE and Action Labs involved, not just the digital equity group. But with the project starting last year, there has obviously been delays due to COVID and the closure of borders, delays with starting the project on the ground, delays with recruitment. But I'm not working directly with those communities, but I'm still involved in Project 2, in particular in coordinating the development of research roadmap. So now coming to my DECRA project. My project is at the intersection of information science, archival science, and ICT for development. So it's interested in the ways people access information, in the preservation of the information, and in evaluating the effectiveness of ICT solutions. So the official title is Record Keeping for Empowerment. I usually avoid the word record keeping when I talk to people outside of my discipline, because record keeping is often understood in a narrow way. In archival science, records can be information in any format that preserve as evidence of an activity. So records can be written, can be digital, can be artifacts, can be people's memory. And when we talk about record keeping, we are not interested just in keeping those records, but in the creation, management of records, their preservation over time, their use by various stakeholders for various purposes, as well as the setting up of a system to manage those records. So my research is interested in the different forms of records that people create, keep, and share for various reasons and for various length of time. And I'm particularly interested in the most marginalized groups in those communities and in having systems that work for them. So why should we be concerned with the preservation of information? Information is increasingly provided online, whether it's in Australia or in Bangladesh, and particularly government like to provide information in a digital form rather than printed form because it's just cheaper for them. The Bangladeshi government had a plan to achieve a digital Bangladesh by 2021, so providing all services online. However, continuous access to digital information can never be guaranteed. Even in a country like Australia, there are people who don't own a phone. There are parts of Australia where mobile coverage is very patchy. The cost of the technology can be too high for some people, or the cost of internet access. People may have a smartphone but no data plan because just they can not afford it. And also the fragility of digital information has to be taken into account. We estimate that digital records last only 5 to 7 years because they may be in a format that can no longer be read because the software may not be available to read those records, or the hardware may no longer be available. So digital records need to be managed over time, they need to be transferred to different formats or migrated to another system, and some care needs to be taken throughout the time that those records will be needed. So it makes sense, and in particular in the context like Bangladesh, to preserve information that people may need again later when they no longer have access to the digital technology. But it is a neglected dimension in development projects and in research. Information behavior research is focused on how people access information, but not concerned with the continuity of that access. ICT 4D is focused on the technology, not the information that the technology enables to access. And archival science is the discipline that's interested in the long-term preservation of records, but it's more focused on records for their cultural value than on the everyday needs of communities. I should have a look at the chat now. I think I'll just continue and look at the questions later. So that quote on the right of the slide is something that one of the project women told us in one of our interviews recently, saying back something similar to what they were telling us 2 years ago, that yes, they like to access information through the phone, but they understand that what's on their phone may not last long, so it is good to also write it down in their notebooks. So my DECRA has 2 objectives. The first one is to design a framework for the application of gender-sensitive and culturally sensitive information dissemination and information preservation programs for rural communities. So I'm interested in both the access to the information and preservation of that information, and in developing a system or developing recommendations for a system that works in the context of developing countries, of marginalized communities in those countries. And in looking at the differences between the ways men and women access information and preserve information. And the second objective, which I'm not going to talk about today, but just to show that there is also a theoretical component in my DECRA is to develop a theory of gendered record keeping to progress archival science theory. So probably of more interest to people in this group is the factor that I'm going to look at, and that I think impact on information practice and the way people access information and share information and preserve information. The focus of my research will be on gender because with Project One, all our research was with women, and I came out of Project One thinking, well, what about the men in those communities? How do they like accessing information? Do they ever use notebook to keep information? And maybe more likely with the men because their literacy level is a bit higher. But a country like Bangladesh has very long traditional practices, and men and women interact in society with their own group and differently. So gender is definitely an important factor, but other factors that I'll be looking at, and that some of the things have come up through Project One and that I want to investigate more, is the age, and age is related to literacy level, but also looking at by interviewing all the people, we may talk more about the traditional practices, the traditional knowledge, and which is transmitted mostly orally, but would they be interested in capturing that traditional knowledge in another form, whether it's written or audio recording. Obviously, the exposure to technology and the income will impact on people's access to information and preferences. If they have never used a phone or cannot afford a phone, they are not going to think of an app as a way of storing information. Trust in the technology itself, trust in the people who help them with the technology, trust in the source of information they can access through the technology, accessibility. It can be the basic things of, can they buy pen and paper in their village, but also in how is the technology designed? Can it does it make it accessible to everyone? And that gets back to literacy level, but also disabilities. Understanding of privacy is something that was interesting through Project One to see that in those communities, privacy is not an individual factor, but a collective factor. So for example, passwords are commonly shared within the family and shared with the project staff that help them with use the phones, or that set up their own Facebook account and then created a password for them, and they didn't change the password, and they didn't find anything wrong with that. Of course, they help us with the technology. They can know our password. So these are some of the factors that I'll be looking at in investigating the preferences in the way people access, share, and preserve information, and another factor may come as well later on in the research. So on this slide, I have put some of the format on the same slides I have put for accessing and preserving information, because they are all linked. So the traditional preference are to use oral communication to share information, to access information, and information is just stored in people's memory, which may cause problems with the traditional knowledge that, you know, if the younger people are not interested in it, there is a risk of traditional knowledge being lost. But this preference for oral communication can explain the popularity of the phones and of the call center as the preferred way to access information. Information being shared with neighbors. So as it was shared in traditional way in those communities, information we provide them through a project is also shared with their relatives and neighbors. So when it comes to using phone, the first reason to use a phone is just to make phone calls. And that brings us back to oral communication and sharing information. When we look at other ways of using the phone to access information, whether it's Google search, whether it's an app to access or to store the information, and we look at written information, information being provided through leaflets or posters and kept in notebooks, all of that brings us back to assess what can really work for people with limited literacy. And thinking of using alternative to text, using images. So one of the apps that was developed for Protic for maize cultivation was using a lot of images. So the maize plant was divided into 3 parts, and then the people would be choosing if the problem is with the top, the middle, or the bottom part, and then there would be different images showing them different potential problem and images of the medicine for those problems. Or using audio recording as an alternative to text. Also, we probably need to look at a community solution rather than individual solution of women having all their own phone, having their own notebook and replicating that information. Is it really a sustainable way? Is it the best way for the community, or should we just have 1 or 2 or 3 if it's, the village is spread out, one digital center or one library, or whatever we call it, where people can access reliable information in the village? But what I'm particularly interested in here is also seeing what we can do for people who are at risk of being left out with the solution that we may develop, or with the mainstream technologies that are used in the village. So my methodology, which has changed and we will keep changing throughout the course of the project, but my intention was to work first with the Protic villages. There are 2 main Protic villages, and neighboring village for comparison, interviewing Protic women in the village who were not part of Protic, men in the same village, and older people as well in the village, and then the similar group in another village, and then looking at other case study. And my DECRA proposal was including a case study in Cambodia, which I may not be able to do. But I've been lucky that I was planning to start with Protic 1, because we have established a relationship with those communities. My research assistant, Anindita, who was a PhD student on Protic 1 and has now completed her PhD, has established relationship with those villages. She has done field work in there, the villager know her. So she has been able to do interviews over the phone. And although we haven't been able to travel in there because of COVID, doing interviews over the phone had the advantage of avoiding all the intermediaries. If I had traveled there would have to establish relationship with Oxfam, with the local NGOs, with the local officials, and there would have been people around when I would have been there during interviews, and that may influence the way people talk to me. And also there's obviously the language problem. Although I'm learning Bangla, I'm far from being fluent in Bangla, and I would need an interpreter. So the PhD student that I'm recruiting for my DECRA has just been selected. He has received his offer of the scholarship. He's still in Bangladesh, but he will also be an insider with knowledge relating to those communities. So we're doing now interview over the phone in one of the Protic village. Then we will be first with the Protic women. Then we'll be doing interviewing other women, men, and so on, and ordering our sample. And then the intention is to have questionnaires for all the Protic women. So it's simple questions when we have targeted them a bit more through in-depth interviews, and to have this questionnaire administered by one of the Protic women, one of the more educated and more confident of those women, which is also a way of avoiding intermediaries and involving the community in the project. And then hoping that I'll be able to travel to Bangladesh in 2022 or at least 2023, otherwise I'll have to rethink my methodology further. So I'm going to stop here